The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Hello and welcome. Today on Meet the Doctor, my guest is William Harris, who is a facial plastic surgeon in Southern California. Welcome, Dr. Harris. Can you tell us about yourself?
Thank you for having me. I'm a transplant, originally from Atlanta, Georgia, did a lot of my surgical training and then did my fellowship in Palo Alto, California. Decided I loved California, which I knew kind of going into fellowship. Was used to a big city growing up and decided LA was a spot to practice, fun as well as a personal interest in just being in LA and all it has to offer and activities around. So that was how I ended up in LA and started my own practice back in September of 22 in facial plastic surgery.
What part of Los Angeles are you in?
So I'm in Beverly Hills, and it's a great place to be. A lot going on. Good place for facial plastic surgery as well.
A bold move. Are there any fun landmarks near you, near your office?
I'm at the corner of Burton Way and Doheny. So it's kind of on the eastern edge of the triangle within Beverly Hills, very close to the Four Seasons Hotel, which holds a lot of kind of award season events. And then going the other way, you've got everything in the middle of Beverly Hills with Rodeo Drive and kind of all the attractions that draw people to the city itself.
So are the traffic jams around your office always for interesting reasons?
You know, I like to think that the office doesn't have as many issues with traffic because it's kind of tucked on the triangle. It has a surface lot, which means you don't have to get into a high-rise parking garage. So it definitely makes it easier. But yeah, there's days when there's lots of traffic related to award season events and that kind of thing, especially with the Oscars just happening.
I bet you see some interesting cars around there.
Oh yeah, I love cars. So I always have an eye out for cars.
What's your favorite car?
My favorite car would probably be a classic Porsche, one of the original Porsches they made, which was a 356. And they made a convertible version, which kind of had a lowered roof, lowered windshield called the Speedster.
I want to hear about your educational path in a moment, but I want to start first with how you think about faces and aging and just what your approach is to beauty in general when you sit down and look at a patient.
Yeah, so I think, this is somewhat of a cliche in plastic surgery now, but I like a natural approach on the conservative spectrum in terms of facial plastic surgeons, I believe. So I tend to really let the beginning of any consult I have with a patient go towards them and them telling me what they're interested in. And I do a lot of listening. And then I kind of give them options of what I can do. And if I see that there's, an area for opportunity that they might not have thought of that would kind of add to what they're interested in, then I'll mention it and explain that. But I certainly don't push any procedures on anyone if they hadn't really thought about it or if it's not an area that is concerning for them. I think plastic surgery has a reputation in some changing appearance or, make someone look like someone else. And I think that's a misconception. I think really what I'm trying to do and what good plastic surgery does is enhance what somebody already has in terms of enhancing the beauty that they have and making them still look natural like themselves, but maybe a more refreshed or younger version of themselves. And, you really shouldn't see anyone that I've done walking down the street and tell that they've had plastic surgery.
Are there any tools or imaging systems that you use to kind of help people visualize what they're going to look like?
Yeah, I think it's a nice way to kind of give someone an idea of what can happen with their surgery. It's never, a fully predictive method of showing someone surgical outcomes, but I use a program called Mirror, which is a big photo suite. And, mainly I use it for rhinoplasty. I think when you get into facial procedures using morphing imaging, it's a little misleading and it's just not an easy way to kind of show after results. But with rhinoplasty, you can really give them a good idea of what's achievable. So you kind of work with the patient in terms of, is this what you were thinking? And then I have to guide them in terms of what I can actually do surgically. So it's a back and forth between the physician and the patient in terms of, what can we do reasonably without changing your airway to achieve kind of some of the cosmetic changes they want. And oftentimes we're combining functional changes as well. So it allows you to show these things in a way that makes it easy to understand for both of us.
Do they get to take home like the video of the imaging, or do you print out the picture?
Usually the way I do it is I'll save all the morphed images, and based on which ones we decide that fits them best or their goals best, I'll send them those images in an email after the consult, and then they can have some more time to think about it, look at those images, and then we'll talk over the next week or so, or however long it takes. Some people, it's months of kind of getting it right. It's less common, but that allows them to kind of be at home, and then we go back and forth. And if there's little tweaks they want to make on what we did in the office, then we can do that, through that outlet.
In your practice, are you seeing mostly rhinoplasty cases, or is it a mix of other things?
I do more rhinoplasty, but I also do a lot of facial rejuvenation, which includes deep plane facelifting, and then everything that kind of comes with facial rejuvenation otherwise. Eyelid surgery, brow lifting, some facial implants in terms of chin implantation, isolated neck lifts, do reconstruction as well for people that have, had trauma for whatever reason, dog bites, cancer reconstruction, do some work with some domestic violence victims as well, who go through various types of trauma in terms of restoring their self-confidence and their appearance.
Something I've always wondered about and never asked anybody is like, if you got in an accident or you had an accident and you hurt your nose and knew it was broken, like let's say you're sitting in the ER and you're like, my nose is broken. Can you just call your plastic surgeon and be like, come over here and help me?
To an extent, I mean, based on my experience, I've seen a lot of people in the emergency room after trauma to the nose. And if you have a deviation of the nose due to broken nasal bones, for instance, there is an option to reset that in the emergency room. I've had a very low percentage of people who are actually interested in that option. The other option, and I've done it in the emergency room, same day as trauma, and you do your best you can. But one thing you're dealing with after trauma, and certainly depends on the timing of the trauma, is swelling, which is a bit of an unknown in terms of, you may reset it and it looks great in the emergency room, but you get 2-3 weeks out and that swelling goes down and it's not set exactly like you thought because it just changes. So the other option is you wait, maybe 3-6 weeks out, let it heal in, and then you address it in a controlled manner in the operating room if needed. And sometimes people, it doesn't bother them enough to pursue it later on, but I always give people two options. We can reset your nasal bones now in the emergency room, or we can kind of do it in a more controlled fashion down the road once you've healed a little bit more and the swelling's gone down.
So if I'm ever in a situation like this, I should just Google best rhinoplasty surgeon in Austin and just call whoever that is and say, I'm in the emergency room. No.
Yeah. If you can get a hold of somebody in the middle of the night, usually, there's on-call physicians for each emergency room. And usually if you can, it's helpful to get a plastic surgeon or even a facial plastic surgeon specifically to at least consult with, and they can send them pictures and that kind of thing. And if needed, get them in there to sew up any lacerations if it's on the face.
Is there anything you should not let them do to your nose in the ER?
I think, anything with resetting nasal bones and kind of structural changes to the nose, I would tend to say go with a trained surgeon who does a lot of facial surgery specifically. Knock on emergency room docs, but someone that's really familiar with that area and kind of the anatomy specifically to the nose. I think it's more helpful to have someone like that if you're going to address it on the spot right after the trauma, as opposed to going down the road a little bit and doing it in the operating room.
Yeah, that sounds like reasonable advice. Okay, so what led you down this path to where you are today? Was there something that happened that led you to know aesthetics was the direction you wanted to go?
I mean, going way back, my parents were both in healthcare. My dad was a general dentist in Atlanta. My mom worked for the Centers for Disease Control in kind of the aging healthcare policy department. So I, had an exposure to healthcare from an early age. I, was always interested in art ever since I can remember. And then, at a certain point, shortly thereafter, probably 10, 12 years old, I became interested in possibly pursuing surgery. And so that was kind of always two paths I was taking simultaneously was art and then kind of gearing up towards medicine. I I felt limited a little bit by the dental field because there was only one option for surgical specialty. And so I pursued medical school instead. And, I ultimately became fascinated with head and neck anatomy more than anything else, and pursued residency in head and neck surgery with always kind of that thought of, I love the aesthetics part of it because it really brings in the artistic side of my mind and allows me to kind of bring those worlds together, which is uncommon in medicine. Plastic surgery in particular is, I think, the only medical specialty where there's actually a subjectivity component. There's only so many ways you can take out an appendix or a gallbladder, but there's a ton of ways you can perform facial plastic surgery. And it's up to the surgeon and the patient in terms of finding a result that they're going for and making that work together. And so I just enjoyed kind of that component, and then ultimately pursued a fellowship in facial plastic surgery. And I think, doing both aesthetics and functional surgery together as well is interesting to me. But the aesthetic world is definitely the part that ties best into my artistic mind.
Who were your mentors during that training, and what kind of impact did they have on you?
Yeah, so I had a lot of great mentors during my surgical training at Tulane in New Orleans. A lot of guys who did various parts of plastic surgery, functional, aesthetic, and everything in between. And they really helped guide me in terms of just staying true to my morals within the field of plastic surgery. I think there's a lot of people out there, strictly for the money within the field, and staying grounded and doing it for the right reasons in order to, help people feel their best, look their best, and then restore people who've had trauma or other issues was an important part I learned in my surgical residency. And then had amazing mentors while I was in Palo Alto who really taught me, a lot of kind of running a practice, but also, keeping that integrity as well, and going for the best results every time and going above and beyond to get there. And also, taking the time to really listen to patients first before implementing our knowledge on them, and also keeping a really close eye on patients post-operatively and checking in on them and just making sure that they never feel like you're kind of leaving them behind after the surgery.
I think especially with the reconstructive or trauma patients, but I mean, everybody needs to know you're still there.
Right.
Was there anything that you learned from doing reconstructive surgery or trauma surgery that helped with your perspective on aesthetics?
Yeah, I mean, I think, there's always an aesthetic component to any head and neck surgery. So every time you close, no matter what you did on the inside surgically, the closure is always going to be what the patient sees. So that was always an important aspect of any surgery to me, and always taking time and being meticulous with closure for reconstructive surgery. But what reconstruction really teaches you over time is the anatomy. I did a lot of cancer reconstruction, a lot of very invasive cancer resection, and then reconstruction surgeries. And so you learn the anatomy inside and out that way, which really helps when you're doing kind of more, for lack of a better word, superficial surgeries that don't go as deeply into the anatomy of the head and neck. So I think that's a big component of having that training behind me and being able to learn the anatomy through those surgeries.
Do you still do reconstructive surgery from time to time?
I do, not the same kind of involved surgeries I was doing in residency, where we were doing, large free flap surgeries and moving tissue from the leg and the arm to the face, neck, to reconstruct defects from cancer. I don't do that anymore, but, small Mohs reconstructions from skin cancers that have been taken off, or, we just did a lady a couple of days ago who had been an acid attack survivor. So kind of helping her with her facial scars and reconstructing her nose was what we did for her. But yeah, it's a rewarding aspect of the field.
When someone comes to see you for the first time and sits down in that consult room, can you take us through what they should expect from you?
Well, I think I try to make it as comfortable as possible. I think it's, intimidating coming into a plastic surgery office in some cases, because you're in a vulnerable position of maybe a part of your face or neck or whatever it may be. If you're going into a body plastic surgery office and trying to explain that to the surgeon and what you're interested in doing. So I try to make it very open and comfortable conversation. I listen a lot in the beginning, and then I try to guide them down the right path, and usually a conservative path for most of my patients and try to give them the ladder of treatments. So there's a lot of non-surgical treatments that you can do before you pursue surgical options. And if that's a better option, then I always present that. And then there's a lot of combinations that are great. So non-surgical combination with surgical procedures. And so I try to give them the best options for them. And everyone's different. Everyone requires a different approach, and everyone has different social components that come into it. Maybe they don't have the time to take off. Maybe they work too much to have the surgical downtime. So you always kind of have to take all those aspects into consideration.
Tell us about the team that you have in the office there. Like, who else might we run into if we come to see you?
Yeah. So, the first person you see is our front desk staff, and they'll get you set up in terms of getting your background, medical history, and all of that. And then if you were coming in for a surgical consult, you would see me, and we'd spend 40 minutes to an hour sometimes, or over an hour with patients going through that process. And then at the end of that, you'll meet our patient care coordinator, who kind of give you a sense of, my availability and pricing for everything, and kind of walking you through our options for that. And then we have MAs or medical assistants throughout the office that help with kind of non-surgical procedures in terms of assisting me and making you feel comfortable during, injectables or whatever it is we're doing in the office. They're kind of my second hand in terms of helping me out and really making the patient feel comfortable.
What are your favorite non-surgical treatments? And is there anything coming that you're excited about?
Yes, there's so many great non-surgical treatments. I really like a couple of the microneedling with radiofrequency devices. There's one in particular called Profound RF, which is kind of a one-time microneedling treatment that has radiofrequency for tightening of the skin, improves texture and quality of the skin as well. But it's kind of referred to as a non-surgical facelift, and it definitely, for a younger person who maybe doesn't have as much skin laxity or soft tissue descent, it's a great option. And then I also like to combine it oftentimes with a surgery that I call the midline neck lift or holiday neck lift, in order to help with skin tightening after it's been completed. It's a very small incision under the chin, which basically tightens the muscles, gets rid of any fat in the submental or area just beneath the chin. And I use the Profound afterwards to help tighten the skin.
Did you name it the holiday neck lift?
I did.
Oh, that's so good. It's exactly what it sounds like. So, what do you like to do when you're not at work?
I love golf. I like to travel a lot when I can. I haven't done as much lately as I'd like to, just with starting a new practice. But love traveling new places, exploring new cultures. In the winter, I try to get in some skiing. I love that as well. And then I would say LA, New Orleans, everywhere I've ever lived, try to explore the restaurant scene a bit.
I'll let you choose which one to answer. What was the best trip that you've ever been on, or what was the most recent trip that you went on?
So yeah, most recent trip I went on was to Germany and Switzerland, which was, amazing. I think both of those countries have a lot to offer. Switzerland's, in my mind, one of the prettiest countries in the world, and got lucky enough to go skiing over there and just exploring that culture. They have great food, but also just very scenic, a lot of hiking and options to do in the winter in terms of exercise. Where we were, they had curling and sledding and all kind of options other than the skiing we did during the daytime. So I thought that was a fun trip, and probably try to go back maybe once a year if I can and get over there and do some skiing, because it was probably the best I've ever done.
I can imagine. I was a cross country skier. So
yeah, I stopped doing that after the first time. I realized you could go downhill, and then I said, I don't think I need to go flat anymore.
It's a lot easier to go downhill.
Yeah, once I figured out you could go downhill, I thought, yeah, that's okay. But it's a good workout.
A lot of skiing in Georgia.
No, actually zero skiing in Georgia.
So did your family go somewhere every year in the winter?
My family didn't always go, but I would go with friends to Colorado. That was kind of the place I went to ski in various places. And then my family and I did start going later to Jackson Hole, which has really pretty amazing skiing. We had a family friend who had a house there, so we got lucky on that front. And I think second to the Switzerland skiing, that was the best.
It's been really nice getting to know you and learn more about you. And I hope that our listeners have a feel for who you are now too. Before I let you go, tell us where we can find more information about you online.
Yeah, so my website is harrisfacialplastics.com. I also have an Instagram, which is just my name. So it's Dr. William Harris. So Dr. William Harris. And then I'm on a couple other sites, Real Self. I'm on Google. I have a Google profile as well. So all those areas are the best places to find me.
Thank you.
Thanks so much, Eve.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, THEAXIS.io.